What causes diabetes? Diabetes mellitus, commonly known as diabetes, is a metabolic disease that causes high blood sugar. The hormones called insulin moves sugar from the blood into your cells to be stored or used for energy. For people with diabetes, their bodies either doesn't make enough insulin or can't effectively use the insulin it makes. If untreated, the high blood sugar can damage your nerves, eyes, kidneys and other organs. Types of diabetes. Type 1 diabetes. This occurs when the immune system attacks and destroys cells in the pancreas where insulin is made. About 10% of people with diabetes have this type. It's not clear what causes the attack. Type 2 diabetes. This occurs when your body becomes resistant to insulin and sugar builds up in your blood. Prediabetes. This occurs when your blood sugar is higher than normal but it's not high enough for a diagnosis of type 2 diabetes. Gestational diabetes. This is high blood sugar during pregnancy. The placenta produces insulin-blocking hormones. Symptoms of diabetes. Weight loss, frequent urination, blurry vision, increased hunger, extreme fatigue, sores that don't heal, increased thirst. Causes of diabetes. Type 1 diabetes. It is not known what exactly causes type 1 diabetes. For unknown reasons, the immune system attacks and destroys insulin-producing beta cells in the pancreas. It is possible that a virus sets off the immune system attack. Genes may also play a role in some people. Type 2 diabetes. This is caused by a combination of genetics and lifestyle factors. Being overweight or obese increases your risk too. Extra weight, especially in your belly, makes cells more resistant to the effects of insulin on your blood sugar. This condition runs in families. Family members share genes that make them more likely to get type 2 diabetes and to be overweight. Gestational diabetes. This is caused by hormonal changes during pregnancy. The placenta produces hormones that make a pregnant woman's cells less sensitive to the effects of insulin. This can cause high blood sugar during pregnancy. Overweight women during pregnancy or who gain too much weight during their pregnancy are more likely to get gestational diabetes. Diabetes risk factors. Certain factors increase your risk of diabetes. Type 1 diabetes. You are most likely to get this type 1 diabetes if you carry certain genes that are linked to the disease or you have a parent or sibling with this condition. Type 2 diabetes. Your risk for type 2 diabetes increases if you are 45 years of age or older. Overweight. Have a parent or sibling with the condition. Have had gestational diabetes. Have high blood pressure. Gestational diabetes. Your risk of gestational diabetes increases if you are over 25 years of age. Are overweight. Had gestational diabetes during a past pregnancy. Have given birth to a baby weighing more than 9 pounds. Have a family history of type 2 diabetes. Diabetes complications. High blood sugar damages organs and tissues throughout your body. Complications associated with diabetes include vision loss, hearing loss, depression, heart disease, heart attack and stroke, sores that does not heal. Treatment of diabetes. Type 1 diabetes. Insulin is the main treatment of type 1 diabetes. It replaces the hormone your body isn't able to produce. Type 2 diabetes. Diet and exercise can help some people manage type 2 diabetes. If not, you will need to take medications that will lower your blood sugar. Insulin may be also advised by your doctor. Gestational diabetes. The blood sugar level should be monitored several times a day during pregnancy. High blood sugar level may be controlled by dietary changes and exercises. About 10 to 20% of women with gestational diabetes will need insulin to lower their blood sugar. Diabetes and diet. Type 1 diabetes. Your blood sugar rises or falls based on the types of foods you eat. Sugary and starchy foods make blood sugar levels rise rapidly, while protein and fat cause more gradual increases. You may be advised by your doctor to limit the amount of carbohydrates you take each day. There is also need to balance your carbohydrates intake with your insulin doses. Getting the right balance of protein, fat and carbohydrates can help you control your blood sugar. Type 2 diabetes. Observing what you eat can control your blood sugar and also help you lose any excess weight. To keep your blood sugar levels steady, try to eat small meals throughout the day. Healthy foods that are important include fruits, vegetables, whole grains, lean protein like poultry and fish, healthy fats such as olive oil and nuts. Gestational diabetes. During pregnancy, it's very important to eat well-balanced diet for you and the baby. Watch your food portion sizes and limit salty and sugary foods. You need some sugar to feed your growing baby, but you should avoid eating too much. Diabetes diagnosis. Doctors use blood tests to diagnose diabetes. How to prevent diabetes. Type 1 diabetes isn't preventable because it's caused by a problem with the immune system. Some causes of type 2 diabetes, like your genes or age, are also out of your control. But there are many other diabetes risk factors that are controllable. The best way is to observe your diet and fitness routine.